that we needed to have a sustainability process in place to enable us to make payments to care providers, not just care homes, but care at home and other registered services, in order to address any additional costs arising from COVID. So we know that that's in place until the end of June. We know that that is helping to sustain a number of providers in the sector, and we await further information from government around the plans beyond June, the end of June. But at the moment, we've got the administration process in place. It's working really well. As mentioned in previous reports this afternoon, we've paid out around £2.7 million to Highland providers, and that process continues in line with the guidance.
Tracy?
Yeah, sorry, just a quick question. Anne, you mentioned about the process needing to be changed because of the finance subcommittee. One thing that just struck me when I was reading the report was the mention of the group membership, and I was just wondering whether that had been reviewed in light of the change in structures, Gillian, or whether there was a need to do that.
If I can respond to Tracy, so there is a need. What I'm very clear when I'm reporting on process is that I don't change the process. So the process that's described within the report is exactly as it was agreed when it was agreed, and so that's the breadth of the remit. I'm untampered with and unchanged, and obviously over the passage of time there will be a need to review and update that. So if that's a request from this group, I'm more than happy to adapt that accordingly based on the current job titles and current structure, and happy to include that in the assurance report that comes back next time.
Are you happy with that, Tracy?
I'm happy with that, thank you.
Okay, Wendy?
Hi, Gillian. I just wanted to pick up on something that you said, just out of interest. You said that you had paid out, was it 2.2 million this year in to care providers?
2.7, yes.
2.7 million, thank you. Just out of interest, what would that look like pre-COVID? So let's say 17-18 or 18-19, what would it been a similar amount, or would it have been more or less?
Thank you for your question. So the 2.7 million is exclusively for COVID related costs. So previously we wouldn't have paid out any sum prior to March last year. So this was an initiative set up by government, paid by government, although through processes that each area have had to put in place themselves. And it is for any additional costs experienced by care providers as a result of the COVID pandemic. And I'd say the amount to date is 2.7 million, which we recover back from Scottish Government.
Thank you.
Okay, so thank you very much, Gillian. So we've considered the report, and I think we can note that we'll get a further assurance report once the process has run its course. So thank you, Gillian. Tracy, are you going to speak to Louise's report?
I'm going to do that, yes. I'm conscious of time, so I'm not going to go through it in a huge amount of detail. I take it that everybody's had a chance to read it. I'll just pick out some highlights. So we were speaking earlier about the partnership integration scheme, so there's a brief update on that, indicating that the scheme has been to both boards of the council and NHS, and a consultation now out around that, so we'll obviously bring back further updates on that. The Community Directorate has had a restructure of the senior levels of organisation, and there's some detail on the posts in that respect. So this is providing a single North Highland service consistent with the idea around the Highlands Health and Social Care Partnership. So it makes a lot more sense of that, and for this committee, I think. So there's now obviously work going on to look at the layers underneath that in terms of how people work together. So there will be further updates on this, but the most significant changes that needed to happen have already happened. The other significant change that sits with that is the move of the rural general hospitals into the acute services division, and that's expected to be completed in terms of the management arrangements in the next month or so. So then we've got an update around the hospital redesigns, the very exciting redesigns in Badenoch and Strathspey and Skye. So the Skye element, because of COVID, is running very slightly behind on the building works compared to Badenoch and Strathspey, as I guess you'd expect in terms of the rurality and the difficulties of access for the hospital in Broadford. So there's a completion date for August for Skye and a handover date in July, the end of July, for the hospital in Aviemore, and all of the redesign work around both of those elements, the redesigns in the community, because remember it's not just about the new builds in the hospital, all of that is also ongoing. What we have highlighted there is an issue around the workforce for the Skye Hospital, but there's that obviously poses something of a risk, but we're mitigating that risk with a business case internally around the recruitment of an additional workforce to manage that situation. On remobilisation, just very briefly, what the organisation has completed and submitted the final version of the updated remobilisation plan. I was at a meeting this morning working on key performance indicators, so there's now some more detailed work to go in around that. I think another iteration of that plan in common with other boards is due in later in the summer. Enhancing community services, that work continues. There are some really useful lessons being learned from that and some excellent outcomes that we're seeing. And we continue to do that and to share that work and see that work spread across all of our areas across Highlands. So work on enhancing community services is going on hand in hand in places like Caithness with the Caithness redesign, in Skye with the work around the community redesign that sits in the context of the hospital redesign. So all of that work is still going on. Then we have quite an extensive report around mental health services, covering unscheduled care, planned care in terms of the psychological therapies work, and the work in primary care, where mental health is the focus this year for the primary care improvement plan work stream. And noting that pilot areas identified for that work stream are in Inverness, Caithness and Lochaber. We've heard quite a lot earlier on from Tim Allison about the COVID vaccination. So there's just a brief update in the report there, as well as an update for primary care around the GP practice recruitment for 2 rural practices in Tongue and Mallaig. So Mallaig is out to procurement, and we've had several expressions of interest received, which is really heartening, because some of these rural practices can be really quite tricky to recruit to and encourage good quality of input and doctors to come and run the practices. So I don't know, Paul maybe might want to say a little bit more on some of the primary care stuff. Primary care improvement programme, so I've touched on that. We already have the pharmacotherapy and the first contact physiotherapy work streams. We've progressed really well with those. Those are already embedded in North Highland. So if you need to see a physiotherapist as your first kind of point of contact for your care in primary care, that is there in every practice in Highland, and there's a newsletter attached to the report which gives you more information, particularly around the pharmacy element of the primary care improvement programme. So I hope that's really helpful. And then just finally on the primary care remobilisation, so GP practices and community pharmacies remained open when other services had to shut down or reduce services during the pandemic. And some services like community optometry and dentistry have been working at reduced capacity, and there are plans in place to ensure that we step up those services again in a managed way to bring all of those services back online. So things like public health screening programmes resuming and things like that had to be stepped down. So Anne, I don't know if you want to, it might be helpful to have Paul to come in to say a little bit more about some of those aspects of primary care, because that's quite an extensive update on primary care in the report.
Does Paul, do you want to add anything to that?
Well, you've done really well there, Tracy. I think it might be helpful simply to get some questions. I'm sure there might be a few around primary care. The main aspect, I consider primary care being general practice, general dentistry, if you like, optometry and community pharmacy. Dentistry is really challenged in remobilising because of their procedures are aerosol generated. And the safety measures have to be very strict indeed in an era where we have to consider COVID. So there are plans in place, as Tracy has outlined, for remobilising all services, but I believe that dentistry will be most challenged to move quickly back to the same volume of care episodes, if you like, the intervention episodes that can be undertaken. So I'll just take questions. I think Nicola wanted to come in first.
Thank you very much for that, Paul and Tracy. I had a question around the primary care and the mental health out of hours service, and it was just my own, I suppose, ignorance of how the two overlap. Obviously recognising that Caithness has been identified as one of the pilot areas, and you'll be aware that we are progressing with the Caithness Cares initiative for young people's mental health and wellbeing. It's going really well with a high level of buy-in from all the professional services and also from the community, which is, as you know, is vitally important. Where we've identified so far a real gap is in out of hours care for mental health. And so I noticed that Lochaber is the pilot area for out of hours support in remote and rural areas, and Caithness is the pilot area for primary care. But I wondered what potential there is for looking at out of hours support in Caithness, and if that would fall under the umbrella of primary care as well, if you're looking at it kind of holistically, or I'm not sure how the two different strands of work overlap, so just any information around that would be really helpful.
Yeah, so the primary care improvement programme is for daytime general practice, if you like, and really that's the piece of work we've been funded for by the government. So 8 till 6, Monday to Friday, and there are 3 pilot sites, as you've outlined, that are in the report. I believe there is a bit of a gap in the transition between daytime services and out of hours services, and also we could enhance the out of hours provision, Nicola, so that would include all the other hours of the week. Through COVID, we did develop and progress improvements in delivery of this through the mental health assessment team. So bringing together all of the multidisciplinary teams in mental health to provide a single point of contact, so that any practitioner may have, or for that matter, any patient or the family member who needs assistance has a single point of contact and able to get some help. But that's only the start, and it's remote. It's not in person, face-to-face assessment, and so we do need to look at how we deliver that. Traditionally, in Caithness in your area, that would be provided by the GP out of hours service or through the hospital services, with liaison in either remotely or in person the next day from mental health professionals. So that's how it is. I don't want to butter coat it. You know how it is at the moment in Caithness, and there is certainly improvement there.
Okay, Nicola, I'm sure you're not exactly happy, but does that answer your question?
Yeah, it is. It does. Thank you. And I'm conscious of time, so I'll possibly pick up with Paul and Tracy offline if that's okay to discuss a little more. Thank you. I'm
sure that'll be fine. Michael?
Yeah, just a couple of questions. I noticed on page 44 there's information about the Badenoch and Strathspey Community Hospital handover date 31st July. Mentions refurbished health centres in Canusie and Granton. What I'm concerned about, and what I've been concerned about for quite a while, and I remember at the meeting before Christmas, David Park apologised for this. There's nothing on here about the North Coast redesign. Nothing about any dates. And this, I know the committee knows I go on about this, but I'm really surprised with this whole refurbish of Northwest and Mid, that there's nothing about North Coast redesign. And I would request at the next meeting there is something about the North Coast redesign. Second question is, with the tongue practice. Now I understand, and this is I don't remember where I got the information, that the TAME practice has taken over the tongue practice. It says here from the 1st of April. Well, I spoke to some in the practice last week and said, when's this going to happen? And they said 2 or 3 months as far as they knew. Could I just ask that though, it's clinical and it's health advice, this is a community service. And, are the new practice, whoever they are they going to contact their patients in the area and say they're the new practice and provide, these are the services they intend to provide, and this is how they intend to work with the community? I'm only asking this question because I don't know whether this will happen or not.
Okay, who wants to pick up those points?
I would pick up the second one, but Tracy may want to take the first one.
Yeah, the first one, more than happy to include a more detailed update on the North Coast redesign next time, Michael. No problem at all.
Thank you, Tracy.
Thank you. So we've had one small business and private ownership moving to another private ownership, if you like. So the tongue medical practice has successfully transitioned from one GMS provider to another. It's been taken over by another medical practice through a competitive process. It was the presentation was really excellent, I have to say, and the services that the TAME practice are proposing to provide was very reassuring during those presentations. So your feedback is really very valuable to me because I haven't heard that from anywhere else thus far. So I think we do need to understand when and how the patients are going to be contacted to be updated, whether that be through a patient participation group, through newsletter, or whatever the population covered by tongue is, would normally receive updates from the practice. I have confidence at this point in time, but my ears are open and I am listening to what you've said, and I can reflect back to TAME medical practice what you've said.
Yeah, I appreciate that. I mean, the only point I'll make is that the 2 previous doctors, when they resigned, we discovered that through the community council, which to me is not quite the right way how it should be done.
Yeah, and that's the responsibility of that small business. We don't set standards. We do encourage every practice has a patient participation forum, every practice has a website that's accessible, and that they have routes to get the views of, from their patients and public. However, none of these items are in the GMS contract that they work under. So these are, service delivery expectations that we have, but not necessarily things that we can enforce. And that's kind of the issue. But as I said, I was very reassured with the presentation from Tana, and I would hope that you would see an improvement in what was your previous levels of communication that you might have experienced, rather than the opposite. But if that doesn't happen, then let me know. I can be a conduit.
I appreciate that. Thank you very much.
Okay, Jerry.
Thank you. I'm hoping a fairly simple question, and I'm happy if someone just emails me something. I'm just interested to know what the focus of the work of the community link workers will be, and whether it'll be the same over the 29 practices or it's practice specific work. Say if it's easier for someone just to email me something that was in the tender, I'm very happy with that. But equally, if you want to talk about it just now.
I wouldn't talk about it just now. I think we need to email you what was in the tender, and Kathy Steer will be the best person to do that, so we can enable that. Because I think there's a bit of localism depending on what's required, but because it's gone out to procurement and to tender, I'm not exactly sure, and Kathy was part of the process, what the successful winner of the tender, what they've actually proposed. I think there's a bit of localism there, but I don't want to say absolutely.
Thank you, Paul.
Okay, so I don't see any other hands up. So I think we'll draw this item to a close. So we've considered the report. Are there any well, we've identified a couple of matters at least on which we're looking for further assurance, such as the North Coast redesign. I see, Tracy, that Neil has put a comment in the chat about possibly we could maybe have a discussion with Alan Wilson about whether we could do a sort of overview report on all the projects, the redesign projects within the partnership area. Possibly, I don't know what you think about that, but anyway, so there's a number of matters that we're looking to get further assurance on. I don't think there's anything that we need to escalate at the moment from what we've heard. So are you happy to accept the report and the matters that we've requested further assurance on? Yep.
Yep.
Okay.
I'm just wondering, sorry, Anne, I'm just wondering in terms of the other redesigns, we used in previous iterations of the Chief Officer's report, we had tried to report on all of the redesigns. So I'm just wondering whether it's worth having reported on Skye and Badenoch and Strathspey this time, that we undertake in the next report to come back and report on Lochaber and North Coast, and do it kind of turnabout like that, because by the time we come back together again, I suppose the Badenoch and Strathspey and the Skye redesigns are coming to the end of the process, whereas others like Lochaber and North Coast are much earlier in their process, although appreciating both have been going on for some time, but they're at a much more exciting, if you like, stage of progression, and might need a slightly bigger or more detailed report on them.
Well, if you think that's a better way to address it, I'm happy to accept that. I'm sure that Michael will be delighted to hear that the North Coast is at an exciting stage of its development. But we'll move swiftly on the back of that comment from me.
Take out drink sometime, Chair.
Okay, right. Thank you, Tracy. If I'm happy with that suggestion, if you think that's the best way to deal with it. So I don't have any notifications of any other items of business. Does anybody have any other items that are not weren't otherwise on the agenda? Don't see any hands up. So thank you very much. I'll finish with an apology for my timekeeping this time round, but I think we had some very important messages to hear earlier on the meeting. So I hope you'll excuse me running over today. And I look forward to seeing you all again at the end of June. Thank you very much. Good afternoon.
Thank you.
Thank you, Anne.
Thank you. Bye.
Thank you, Anne.